From the red carpet to social media, we've witnessed stars undergo remarkable transformations. But have major celebrities like Dolly Parton, Chrissy Teigen, and Howard Stern had plastic surgery? I'm joined by Dr. Anthony Youn, and we're going to explore the captivating journey of some well-known personalities. So our first celebrity is Michael Jackson. So we see him here at age 21 in his 40s. And to me, what really sticks out is the nose. I think he's had many rhinoplasties, many different nose procedures, and you can see how much more narrow it got to the point of most likely affecting his breathing. I'm thinking just that to me is the most obvious. There's so many changes that have occurred, but right there in the center of the face, that's what really pops out to me.
Yeah, it's funny. I did some training out in Beverly Hills, and one of my receptionists actually used to work in an office where he would come in and get reportedly plastic surgery. And they said that every month or two, they would get a check in the mail from MJP, Michael Jackson Productions, to the plastic surgeon. Now, I don't know exactly what they did specifically. I think the nose is the obvious part of it. I think the thing that's really interesting is what happened with the skin color, because there are a lot of ways now to lighten the skin that I'm not sure were available even back then.
Yeah, and it's confusing because he did have vitiligo, which we know lightens the skin, but usually not as homogeneously as he has. And so surely there was something other than the condition, but then he did have that underlying condition, so that it complicates the interpretation. And I've had a few of our viewers ask for analyses of celebrities where I know that they have an underlying medical condition.
Yeah.
And there are just a few people, like one that comes to mind is Selena Gomez. Like I stay away from that analysis because I think the lupus and the requirement for steroids and I think she had maybe a kidney transplant. I mean, that makes it so difficult to interpret what's actually happening on like the cosmetic, aesthetic side of things. And so that I think is also what makes it interesting with MJ's case. Like you said, what really happened with the skin color.
Yeah, there is actually IV glutathione is being used in Asia quite often for overall skin lightening. I've heard a few people using it here in the States now. I've never seen it. I'm not a big fan of that type of thing, but supposedly that's one way systemically, basically, with not using creams, that people can actually lighten their skin. So Gwyneth Paltrow is the head of Goop, and she's out there promoting natural beauty and natural treatments. Obviously, she's controversial because some of her treatments some people disagree with, but I think one thing we can all agree with is that she looks fantastic. Now, I don't think she's had that much work done. It's possible she may have had a rhinoplasty. Her nose does look maybe a little bit thinner. Maybe she's had some other minor tweaks, but overall, I think she looks pretty natural to me.
Yeah, I agree. I think she looks great. Like to me, what slightly jumps out is the upper eyelid area. Mm-hmm. Just looks like maybe there's a little bit more hollowing there, which we know can happen with the aging process, but then also possibly from like the brow lift and or like an upper bleph, but it's definitely hard to tell in her case. So Tyra Banks, when I see her here at age 25 and then compared to her 40s, overall, I think she looks great. I think she looks quite natural. To me, what jumps out is that the cheeks are quite prominent. And so I don't know, perhaps she had some cheek augmentation, whether it was with filler or maybe like a cheek implant, but it just looks like they're much fuller than they were even in her 20s.
Yeah, I would agree with that. I think it definitely looks like she may have had some filler there. The other things I see, possibly a thinning of the nose, so maybe a rhinoplasty at some point, and then maybe even her upper eyelids. Now, as you mentioned earlier, though, the eyelids can lose volume as we get older. Is that a consequence of just getting older, or maybe has she had a blepharoplasty? Either way, really, if she has had plastic surgery, it's been very well done. It's that whole sign of what's good plastic surgery. It's plastic surgery that's so good you can't quite tell it's been done. The person just looks fantastic. So Joe Jonas is one of the few men on our list, and I think he's a great choice. I'm glad you brought him up because he's also one of the few males who has admitted to getting work done. So my understanding is that he has admitted, I think, in the past to having neurotoxin, whether it was Botox or Xeomin, I don't recall. But he looks fantastic. If I look at his photos, I'm not seeing anything real obvious, other than maybe a touch of Botox here and there. I'm not seeing anything major surgical here, in my opinion.
Yeah, I think he was in a Xeomin commercial. So
we
did a video on, I remember covering him, and I think we did a longer form video, or maybe it was like a shorts clip or something. And I remember watching that commercial. It was quite funny because like it was just so staged. But I think that's really cool that he was public about that. And I agree. I think he looks great, and he looks pretty similar, like 10 to 15 years later. So that's impressive. So next up, we have Chrissy Teigen. And Chrissy Teigen is another celebrity who has admitted to plastic surgery, including a procedure that I do fairly often, which is an eyebrow hair transplant, which I thought was really cool. We covered her going public with that in a prior video, but that's not the most common plastic surgery. So, and I think she also said that she did get a buccal fat removal. So those are two, and maybe even she's spoken about others, but. To me, and look, I think one of the things to remember is that our weight does fluctuate, of course, and so maybe when these photos were taken in her like mid 30s, possibly there were some weight changes. So it's hard to say if it's, just the weight fluctuation or say like filler injections, and it could be like a fat transfer, but there's something that's causing just more like overall volume to her face, and we know that HA filler can migrate, and so maybe that's what's going on. But also sometimes I feel like fat transfer, if it's overdone, it can just give you a fuller appearance, and it's hard to get rid of that.
Yeah, and I'm sure you've had patients, I have, where they get fat grafting, fat transfer, and then they gain weight, and the fat gets fuller as well. I actually had one patient who I did fat grafting to her face when she was fairly on the lower side weight-wise, and then she got pregnant, and she told me it was so funny because her lips got so big when she was pregnant, and then it all settled down afterwards. Now, I agree with you. I think, Chrissy has been upfront that she's had some things done. Admitting that she had a buccal fat removal, that I think was part of what caused this kind of huge, social media firestorm or frenzy of buccal fat removal and everybody getting it. As you and I know, this is not a new procedure. I started doing it way back in 2004. But the key with buccal fat removal is to choose your patient wisely. You don't want to do it on somebody with a narrow face like you or I. That would actually be aging to us. But on somebody like Chrissy, where she's got a rounder face and just wants to contour it a bit, it could be a really nice procedure. And so I enjoy doing that operation. But once again, patient selection is totally key here. Like you or I, horrible candidates for buccal fat removal. Well, here's another guy, Steven Tyler, and he's the lead singer of Aerosmith. And honestly, I've never really thought much about what Steven has had done. But looking at these photos, I think he may have gone under the knife and had a little bit of tweaks here and there. So what I'm seeing first is his upper eyelids. And upper eyelid surgery, called blepharoplasty, definitely has to be done differently in a man than in a woman. Because if too much skin is removed, you can get into a situation where the person looks very, very different. So when I look here at Steven Tyler's eyelids before and after, it does look to me like he may have had his upper eyelids done where skin was removed from the upper eyelids, caused them to look a bit more open. Now, this is how we're used to seeing him, but my guess is that if he hadn't had his eyelids done, he would look quite a bit different today than he actually does.
Yeah, that's a great point. Also, I'm seeing that the eyebrows, though, haven't really changed a whole lot, and I think that's one of the keys. I think a brow lift in a man is very tricky because it's generally a feminizing procedure. It has to be done very carefully when it comes to brow lifting, and I don't necessarily think that Steven Tyler had that. So an isolated upper bleph, it can still give a natural look. But when you start adding, brow lifting, it can be quite tricky to get that right in a guy.
Yeah, the hard thing too, as you know, is the hair, of all people you would know, is that the hair does change as you get older, and men have to be concerned. If you do a brow lift, you get scars in the scalp. And if your hairline recedes, or if you go bald, those scars can be visible. And so I'm very cautious doing brow lifts in men. I do very few of them in men just because I worry that what may look good today, 10 years from now, may not be as desirable.
Okay, next up we have Iggy Azalea. And looking at Iggy, so this is like 10 years apart, and I'm seeing that first of all, her eyebrows are fuller, and it looks like it's mostly makeup, but it's just interesting that she's choosing to go with fuller brows. I think that's sort of in vogue, now. And her lips also, when you look at especially her upper lip, it just looks, not sure if it's overlined or if there's some filler in there, but she's just choosing to go with a much fuller upper lip. And her nose, to me, does look more narrow. So again, maybe that's the effect of makeup. She's wearing a lot of makeup, at least in this photo. It's possible to give the nose a much more narrow appearance with makeup, but she also looks like the tip has been narrowed. I mean, that is a real possibility here.
Yeah, I totally agree. I mean, I do hand it to Iggy Azalea in that she's been very open that she's had plastic surgery. And so what we're seeing here, I think we can kind of assume. In some cases, I try to give the benefit of a doubt that maybe somebody hasn't had work done. In this case, it would almost be the opposite because she has been so open that she's had work done. And I do think she's most likely had a decent amount of filler injected. I agree with you. I think that the nose does look like she may have had a rhinoplasty, although yes, aggressive contouring is pretty impressive what that can do nowadays. But with as open as she has been with plastic surgery, I wouldn't be surprised if she's had a decent amount of facial plastic surgery, mostly injections, but maybe even a few operations.
Yeah, and she's still quite young, and this brings up the notion of surgery at a younger age. And I think this has been a trend that, I don't know, maybe started within the last decade. And you've been in the field longer than I have, but it just seems like people are getting more surgeries younger than they used to. And maybe because we're talking about it more through forums like such as this, and just in general, it seems a little bit more accepted to get the surgeries. But that goes even for some slightly more aggressive procedures like a facelift that has bigger risks than certain other surgeries. And I think some drawbacks to starting very young. So I don't know if you want us to just speak to that.
Yeah, I agree with you. I mean, the problem that we're seeing now is we're seeing people who are in their 20s and early 30s, and they look like people who are in their 50s who've had a bunch of work done. Because things are so overfilled, over-tightened, and they don't look like they're just naturally getting older. So I do agree with you. I think that it really comes down to how much you have done. I think if you do little tweaks, that's one thing. I saw a video today about a woman who was, I think, 35 who had a facelift. And I don't know, for me, I feel like that's just too young. You get scars from it. And I also believe if you're doing facelifts at that young of an age, I believe that you can really only have up to 3 in a lifetime before that scar tissue really becomes visible on the surface and becomes potentially problematic. And if that's the case, do you want to start that young? I don't know. So I'm not a big fan of early interventions like this. And so in general, I do take the more conservative side. Well, Dolly Parton is a legend both in music and in fashion and in plastic surgery. I think that she, of all celebrities, probably is the most open of the work that she's had done. So I think Dolly looks fantastic. I mean, Dolly is Dolly. There's some people that have a ton of plastic surgery and we look at them and go, oh, we feel bad. But Dolly is Dolly and she looks amazing. She's had a ton of work done. I don't know how many facelifts she's had done. With Dolly, it's more what hasn't she had done than what has she had done. And you know what? All the more power to her. She's just doing great. And I think she's such a great force in the global community for overall just goodness.
When I look at the photos, I think the teeth are playing a really big just overall kind of role and impact on her looks. I don't talk about veneers as often as maybe I should in my videos. The truth is, I don't feel like I'm an expert in that at all. I have friends, who do cosmetic dentistry. I just refer to them, and I know sort of the basics of that. But you can tell that from 30 to 77, her teeth are just like shining, and they're looking fantastic, and that really can change the face quite a bit, more than I even normally think. Because I'm just looking at other features, but teeth definitely play a huge role.
Yeah, and honestly, anytime you see somebody in Hollywood and their teeth are just blindingly white, they're porcelain. The most common cosmetic treatment other than Botox and filler out in Hollywood are veneers. Like the majority of Hollywood celebrities have them. I feel like it's almost the exception when they don't. And it's those blindingly white, perfect teeth. Those are not real.
Next up is Cindy Crawford. So when I look at her here, overall, I think she looks very natural. For 57, she looks amazing. A few features that stand out to me are that the eyebrows do look lifted. They look almost a little bit higher than how they looked at in her 20s. So to me, that is probably, the result of surgery. When I look at her nose, right in the middle, she has almost like a bit of an inverted V deformity, a little bit of a collapse right at the midvolt. And it just stands out to me. And it's something where, people go in for a rhinoplasty and they don't think too much about it. They just want something that looks more narrow. But if you don't support the mid-vault, as we know, there tends to be a collapse over time that can affect breathing, and it can also affect the appearance of the nose. But back in the day, rhinoplasties were just like, let's just remove. It was a reductionist type of approach. And now we think about it as more as like building, like how do we build a solid structure? But many people still get this today. So I think that it's good that at least it's on our minds now as surgeons to try to avoid this type of feature of some rhinoplasties.
Jessica Simpson was kind of the darling in the early 2000s. I was actually one of the dancers at Dick Clark's New Year's Rockin' Eve when she was actually one of the hosts of the show. So I saw her very up close and personal. But this was back in 2003 or 2004 when she was young, and I don't think she'd had a whole lot done. Now that she's gotten a little bit older, I do see that I think she's getting a good amount of injections, specifically filler. If you look at her lips, if you look at her cheeks, they do look quite plump, and to me, a pretty obvious sign that she's had some filler. I also think she's probably had some Botox also in her forehead, in between her eyebrows and the glabella area, and this could be causing some of her shape of her brows to change a bit too. I'm not seeing a ton of actual surgery with her other than possibly a rhinoplasty. Her nose does look a little bit thinner, but honestly, I think if I had to pick one operation that has the most celebrities who've undergone it, it would be rhinoplasty. And you can spot these in celebrities that you would not think has had it done. People who you think, oh, they're totally natural, and you look at their nose like, no, that's an operated nose. So I think she may be one of those. Her sister, Ashley, definitely had a rhinoplasty done, and that completely changed how she looked like way back in the day.
Yeah, I agree with all of that. The lips really do stick out to me. I mean, I think that there's this attempt, that people make to try to get back to the original lips, because sure, there's some deflation in the lip volume as we age, but it's very easy to overdo it. Next up, we have Mickey Rourke. I mean, I think, look, at 70, he overall looks fine. I think it's just when you compare back to his earlier images, you can really see that there's been a major change. And what sticks out is that kind of upper third of the face. It just looks like it's been overlifted. This is, one of those cases where you really say that, maybe they just lifted too much. And I think this could have been the specific type of brow lift that he had. Nowadays, I feel like the community has moved more towards lateral brow lifting, where it can still look natural. And we know that over time, it's really that lateral aspect that tends to droop more than the rest of the brow. But classically, brow lifts were done just collectively throughout the entire brow complex through some larger incisions, even with endoscopic approaches. And when you lifted up that entire brow, it just didn't look natural. You weren't bringing them back. Look at him at 32. I mean, his brows were never too high up. And so now you've created this unnatural appearance.
Yeah, I think it's important for people to realize that plastic surgery in general, 90% of our patients are women. And so these techniques in general are based off of the female face, not the male face. And so if you're getting work done as a male, unless you are, wanting to look more feminine, those procedures are going to go in that direction. So Christie Brinkley, I think, is a great example of somebody who people say is aging gracefully, but plastic surgeons and experts would tell you that she definitely has had some help from a plastic surgeon. So in addition to having some filler, in addition to having some Botox to smooth out some lines, I do believe she's had at least one facelift. You cannot be the age of 69 and have a jawline like that without having work done. I mean, obviously, I've not treated her, so this is my opinion, but man, that's a great looking facelift result for her. I also think it's possible she may have had a brow lift at some point. I think it has settled nicely because her brows are always on the fairly low side and they don't seem to have changed where they are when you look at the age 24 and age 69. So to me, that's a sign that she most likely has had a brow lift. I also think she's probably had an upper blepharoplasty. She's kind of in a situation, in my opinion, kind of like Dolly, where it's not what she's had done, but what hasn't she had done. But I do think the work that she's had done has been very tasteful, conservatively done, and overall, I think she looks fantastic.
Yeah, I think she's definitely maintained that heart-shaped face, out into her late 60s, which is impressive. And I think it is with the help of surgical procedures, in my opinion, as well. I think also maybe a cantoplasty here, in addition to the other ocular work. It just looks like, especially that right eye, both eyes just look more sort of lifted and pulled. And sometimes, that's just done right at the level of the canthus, and sometimes it's just a result of that lateral sweep with the facelift. But yeah, it definitely looks like this is not just completely natural aging.
Yeah, and she also does not have any under eye hollows. And so most likely I would think she's had either a significant amount of filler injected under there or maybe fat grafting. It's hard to say. But really overall, you would think somebody her age would have some definite under eye hollows and some puffiness of the lower eyelids. But that whole area, I mean, there's no lid-cheek junction. Normally we've got a junction where the eyelid meets the cheek. You don't really see it with her. It's just all filled in like she is 18. I don't think that volume is natural, but it does look like it's been very well done.
In our youth, whether it's teenagers or even younger, we have certain facial features, and surely they get, the aging process will change them. Things get more amplified, but that base feature is still there. And then now it's a good segue into Jamie Lee Curtis, where those very natural features of aging, I think, are what we're seeing with her in her 60s. I don't know. Perhaps she had something done along the way, but honestly, I don't really see too many obvious signs. I mean, her eyelids have gotten heavier. Her brows maybe are in a similar position, but that could be natural. Maybe you can see all the wrinkles of aging, and it's honestly quite beautiful and refreshing, especially with all the modifications that we see in many of the celebrities. I think she looks great. You can see like the platysmal banding in her neck and some jowling, but she looks just natural and beautiful.
Yeah, I think she's been very outspoken of saying that she's done having work done and she wants to put a natural face out there. I do think it's possible. Way back when, she's had some procedures done. Is it possible she had her nose done at some point? Maybe. Maybe even potentially had some type of a lifting procedure. But I agree with you. I think that now she's definitely going to, from here on out, go on the completely natural route. And it's nice to see somebody feel very comfortable with that. The only thing for her is it almost gets to a point that you wonder whether I don't think she's doing that, but you don't want to also shame people who have had work done. And there's so many of her contemporaries who've had plastic surgery. They look great. But really, I agree. It's refreshing, but at the same time, as long as it's not judging the others who have done some little tweaks here and there.
Yeah, I think ideally in our society, we reach a point where it's like it's all good. Whatever it is, whether you're doing, you're getting procedures done, you're not getting procedures done, like that's okay. Let's just like talk about it, and people can decide what they choose to do.
I think it's important in Jamie Lee Curtis's situation too to mention that she probably is eating a very healthy diet. She's probably using a lot of really high quality skincare products. She probably wears her sunscreen religiously. And all of these things can really result in that glowing skin and stuff that she's showing off in these photos. So yes, you can say, yeah, I'm going to grow older gradually. I'm not going to get work done, but she's doing a lot of things, I bet, non-invasively that are helping her to continue to look as great as she does.
And then for people who are, cost conscious, which is the majority of people, what would you say are some good bang for your buck cosmetic treatments?
If I were to recommend the best bang for your buck, as far as at-home treatments, if you don't have access to a med spa, dermatologist, plastic surgeon, then I think red light therapy is something that people don't talk enough about. Red light therapy is a natural way basically to use red light to ideally, the belief is that it helps to power the mitochondria in your cells. And there are studies, actually split face studies that have been done on red light therapy where you treat one side of the face with red light therapy and a sham laser on the other side, and have found an improvement in wrinkles, in hydration of the skin, and even in collagen and elastin in the skin. So red light therapy, there's many ways to do it. You can do a tabletop device. There's kind of creepy looking masks that you can wear that look like Hannibal Lecter masks. That's, I think, great bang for your buck if you want a simple DIY at-home option. If you're looking to go into a med spa or plastic surgeon's office, I'm a big fan of microneedling as a really inexpensive treatment. And then IPL also, if you want to get rid of dark spots, great way, not that expensive, and really works well.
And the laser light therapy, some of my patients are using for post-operative healing to improve the healing process, speed it up. And then also for some hair restoration, we know that they're like the low-level laser light, which is, I guess, somewhere within that same family.
Yep.
And it's promoting hair growth, to a degree. So yeah, there's some nice treatment options.
Yeah, I use that on my head 30 minutes every other day because I don't want to come see you.
Good.
But if I needed somebody, you'd be the one I would go to, that's for sure.
Thank you. I appreciate that. Let's stop for a moment and talk about your new book, Younger for Life. So you've written a number of books, I believe, right before this one as well. I just wanted, to get your thoughts on like what was the motivation for writing this one?
Yeah, thank you. So yeah, I've been a plastic surgeon in private practice for almost 20 years, and I've realized that I do believe a very high percentage of people, if they want to look and feel their best, don't have to go under the knife or even the needle. And so it's a concept that I have come up with. The idea is called autojuvenation, and it's the fact that your body has regenerative abilities and the regenerative ability to rejuvenate itself if you give the body the tools to do so. And so really it focuses on 5 main things: what you eat, when you eat, nutritional supplements, skincare products, and non-invasive treatments. Now, you and I, we do a lot of surgery, we treat a lot of people with invasive treatments, but I do believe that there is so much that we can do short of that to help people look and feel their best. And the vast majority of people, I feel, can feel great about how they look without having to, let's say, go under the knife with you or I.
There's like a psychological component to all this, and it's sometimes you might have a person who looks, like they maybe have started to feel the effects of aging and they have more wrinkles and things are drooping, but they feel great and they're confident in their shoes and they're not looking for any treatment. So I think there's also that, it's like how we view ourselves that seems to be relevant as well.
Yeah, and I feel really in the end, what is beauty? And I think it starts with health, being healthy, that is beautiful. And so really what I'm trying to do with the book and with a lot of what I do on social media is try to encourage people to look at beauty and anti-aging in a more natural way. Yes, I still do surgery like you. I mean, I operate 2-3 days a week. I still do facelifts and eyelid lifts and all of that. But I try to use it as a last resort because I do believe that there's so much that we can do short of surgery to help us feel and look our best.
And then, Anthony, how does someone pick up your book, Younger for Life? Where should they go to buy it?
So we encourage people to go to, it's everywhere. You can go to Amazon and Walmart and Costco, but we encourage people, if they can, to go to bookshop.org. This is a website where you can actually support your local bookseller. And if you go to bookshop.org, you can actually choose your local bookstore, an independent bookstore, and the profit from that sale will actually go to your local independent bookstore. And then we have a website called autojuvenation.com, where if you buy the book, you get a ton of free gifts, including a companion recipe book and a $30 gift certificate to my online store, Youn Beauty, if you want to try our skincare products or supplements.
Sometimes I get asked about collagen supplements, and I know very little about that, but I know that you've talked about it in your book. So what are your thoughts on collagen supplements, especially from like the literature perspective?
Yeah, a couple of years ago, there wasn't a lot of science behind, either plus or minus with collagen supplements. But now actually there is a lot of science to support that these actually work. So the skin is composed about 70 to 80% of collagen, we know. And our collagen, we actually lose about 1% of the thickness of our collagen every year, starting maybe in our mid-20s or so. And so the idea behind taking a collagen supplement, and the big question is can it actually improve the collagen of your skin? And there was a meta-analysis published in 2021 that looked at over 1,100 people taking collagen supplements for 90 days and found a statistically significant improvement in hydration of the skin, in wrinkles, and in elasticity. So the science is out there now showing that taking a collagen supplement can definitely improve the health of your skin. But it's important to realize that collagen supplements are not substitutes for protein. It's not a macronutrient. It's not a complete protein. And so you still want to take your normal, if you're following your macros, you still want to eat protein as you normally would. This is just as a supplemental for your skin. So I've always been a big fan of Howard Stern, and the shock jock, has admitted to having undergone a rhinoplasty and submental liposuction under the chin. He actually said I think he said that the nose job was really painful, which I don't know. I find that usually when I did it for 10 years, pain wasn't usually a big issue, but maybe he had big splints or something. And he looks like Howard, I mean, I can't tell necessarily that he's had it done, but He has said that he did undergo those procedures.
To me, honestly, I mean, just from this, again, like we said, it was just a snapshot. But when I look at his nose at age 32 and then now 65, it looks more crooked now. That could be just a result of natural aging, but it can also be from prior surgery.
Yeah.
You know, I think one of the biggest misconceptions about rhinoplasty is that it's permanent. You know, so for some reason, every other plastic surgery, you know, gives you 5-10 years, but a rhinoplasty, it's just you have it for life. And that's just not true. Like the nose ages along with everything else. And even if you fix those cartilages into position, they might bend and move with time, you know? And I think maybe that's what we are seeing here, because it looks a little bit C-shaped.
Yeah, I found so many times when I did rhinoplasties and somebody has a crooked nose, you break the nose and then you inset it and you put a splint on their nose for a week or so. But the problem is that even though you may break the bone and reset it into a new place, there's memory on the other tissues that you haven't disrupted. And I do believe I have seen a lot of people from my patients and other people's patients where you try to straighten the nose and eventually it kind of goes back to where it started. The body has memory with this type of stuff. And sometimes it's not just enough to break a nose and set it for a week. I don't know if you kept a splint on for like 6 weeks or 2 months, if that might help. But who wants to wear a splint for that long?
Dr. Anthony Youn, thank you so much for joining me today. This has been a real pleasure. And I hope everyone goes and picks up your book, Younger for Life. It's a fantastic read, and I really enjoy your content.
Thank you. Well, same here. We'll have you on my channel as well here in the near future.
Awesome. Thank you.